Okay. There you go.
Hopefully that'll work. Good morning, everybody. Thank you for the invitation. I appreciate being here. So I'm going to start with a quiz. I know it's only 8 o'clock, but here it is. So which state was one of the earliest adopters for broad insurance? Wisconsin. You peaked. All right, which one built the foundation for TRICARE? Okay, it's going to be an easy. It's going to be the same answer. You're going to get this, right? National pioneer in Medicare. I mean, WPS really was the pioneer in this area. We were one of the first adopters of the HMO model way back in the day. We also were pioneered what became MRIs, combining the CT technology with X-rays back in the day. In fact, we have an illustrious list of innovation that this state has brought to both healthcare itself in terms of clinical delivery, but also in terms of the constructs around insurance and around delivery itself. So with that, you do have some amazing people that are going to be speaking this morning, and I'm just very happy to be and proud to be one of them. So I'm going to talk about Holista, and first of all, I think it's important to understand what problem are we trying to solve, and we'll get into our client base in a minute, but really we serve the self-funded employer. And for those of you in the room, you know that this is where it all rolls downhill to, right? So at the end of the day, you're the one that's picking up the tab for all of the challenges, be they pricing or otherwise in healthcare. And it rolls downhill to you. So we have been setting ourselves up in a position to address that on behalf of our self-funded employer clients. In Wisconsin, I'll talk about how we address that, but in Wisconsin, we have approximately 250,000 covered lives between Wisconsin and North Carolina. The majority of those are actually in the Wisconsin marketplace. We put together episodes of care. I'm going to define those in a little bit and distinguish them from what you probably know as a bundle, but we have a little bit different twist on it. We have over 200 episodes of care that are currently being utilized in over 30 specialties. A couple of these are up here right now, and that list keeps growing. As soon as I do a slide, it's already late. So we want to use a financial mechanism, AKA bundle. So when we bring together those elements, so we have a facility, we may have a surgeon, pathology, radiology, anything that would go into, let's say, a total knee. We will have a financial arrangement that goes around that. And that financial arrangement is what governs the payment of that function. But we don't serve just that financial function. We really are looking at the relationships between how the construct, who are the stakeholders in our market? So we're talking about the employers and their consulting groups, right? The brokers in particular, straight consultants and other situations. What are the strategies that are being employed from a plan design standpoint in order to address some of these issues? So we use that relationship to help do some of the education around what our product and services can do. At the same time, we want to support that member, that patient, and also that provider. One of the things that we firmly believe is that even though there is a 6 standard deviation cost differential between, pick your procedure, total hips, total knees, myringotomy, you will be able to find 6 sigma variations, 6 standard deviations in what the cost of those like services are. That's insane. At the same time, it can't be a race to the bottom. We can't be shooting for the absolute lowest price. We have to figure out what is the sweet spot, what is the sustainable price. So we work very closely with providers to help understand what it takes to deliver those high quality services, and how do we do it in the best way that's possible and sustainable. Holista has built from the ground floor up a single point solution. It really serves all of these aspects of the care delivery model. I mentioned bundles. I'm going to talk about care pathways a little bit too. This is the patient experience that sits on top of this financial arrangement. It's a concierge experience for that member. I'll show you in a minute, but we have both applications on the phone as well as on, whoops, that didn't work, as well as on your desktop. And really, it's a way to interact as you're going through that patient experience in whatever care that's being delivered. Whether that's a myringotomy for your kids, whether that's a total knee or total hip, there's a care pathway that's been developed by the physician champion for that area. And it's really, what are the 6 things that need to be done that'll enhance the outcome for this patient if they comply with those. And we build that into a very easy to follow and very patient-friendly reminder set that allows you to interact with our interdisciplinary clinical team. So as you're going along and preparing for your surgery, you're being prompted at these different points with things that you need to know at that point going into it. And then following that, we also make sure that your pain scores are being leveled, that you're getting to physical therapy, that you're not having any care gaps. And really that's what we're focused on, is how do we reduce any care gaps that exist so that you can get the best possible outcome for your care. So what makes us innovative? What makes us different? Well, one of the things I mentioned earlier is it's a single point solution. So we have everything that's built into a platform that was built from the ground floor up. It's built to purpose. So we have the ability to do things that most don't, because we didn't take a software solution off the shelf and try to make it work for us. We thought very, very long and hard, actually 4 years of thinking before we even put the first shovel in the ground in terms of building the platform. And we came up with a design that would allow us to have a single technology solution that's a plug and play that also allows a single solution for a health benefit plan to access, as I said at this point, over 200 episodes in 30 specialties. So it's a one-stop shop that gets you all of these, access to all of those episodes. Talk a minute about bundles versus episode. I've alluded to this a little bit, but a bundle typically is a financial arrangement. Sometimes there's some transparency to it. Often there's not. With Holista, you know what the number is going in. We publish those numbers. So you'll know that a total knee will cost you X number of dollars, all in. Typically what our clients do is they will pay first dollar because the numbers that we're delivering on are so far, not gonna say below market. They're so competitive that it makes it easy in the health plan to be able to do something like that. So we have the financial arrangement with transparency. We engage that member clinically, as we were talking about. Our network is rigorously credentialed. You've heard, I'm sure most of you have heard of NCQA. That's our starting place. We then dive way deeper in terms of the care that's being provided by those folks over time. And then we we monitor that on an ongoing basis in order to assure continued success and sustainability. One of the, I think, most important aspects, put what I've said aside, one of the most important aspects or outcomes that we have is the patient experience. Our patient experience is outstanding. We have a net promoter score in the 90s, in the high 90s. That's because our members are having the support that they need. They're not being left with questions. They have someone that they can interact with. One of the biggest, it was interesting to me, one of the biggest indicators to success in a surgery is one simple question asked of that member before the surgery. Do you feel prepared for your surgery? A surgeon will tell you, and they've told us, if that member answers no and you don't fill that gap, don't bring them in. Reschedule the surgery. So one of the things that we're assuring before that surgery takes place is that, in fact, that member is prepared for that surgery and ready for it. Ultimately, that leads to our Net Promoter Score being as high as it is. One of the other things that we felt was necessary and important was complication protection. We work in a business where even the best of the best of the best still has a small percentage of complications that happen. And we don't want that to fall necessarily on the physician. We certainly don't want it to fall on the member, and we don't want it to fall on the plan. So we actually have complication protection that we purchase from Levitt Re. That is a commercial policy. Every single episode that we have has a policy that's issued, and it's first dollar policy, so that if something happens and goes sideways, that there's no out-of-pocket from the member, there's no out-of-pocket from the plan, and it doesn't hit the professional liability for the provider. In addition to which, that member can go anywhere they want. We see a lot of that happen in the market where it'll be self-insured, where the provider will say, well, if something happens, come back to me. What we found was if the member a patient is having an issue, they generally don't want to go back to the person that caused the issue. So what we've put into place is this commercial policy that allows them to go wherever and still have that coverage. I'm going to talk about alignment and accountability as well as we get through here. Top performing providers, we use evidence-based care pathways, the member engagement through our platform. We have outstanding outcomes. Talked about the warranty, complication protection, and we are nine years into this. And we have done thousands and thousands and thousands of episodes, both here and in North Carolina, and had tremendous success. So what happens? How does this work? The member is enrolled. We work with direct primary care. We work with care navigation groups. We work directly with plans themselves, brokers and consultants. Whatever that etiology for that member coming to understand that they need care, those are the people that we're working with to help them understand how they can access that care. We have a platform, as I said, that's set up. We also have a front-end service that services not only the members, but also our channel partners. That member gets introduced to us, and we allow them to see what the cost of that care, what those choices are. Where can you go? Where can I go for these services? What is it going to cost me if I go there? I'm going to back up just a half a second because it occurs to me I left one key piece out. We're not a replacement network, we're a plug-in. So we work with partners like health payment systems, and we plug into benefit plans. Typically, you're going to have your PPO benefit that is structured with copays and deductibles. As I mentioned earlier, generally speaking, employers do not charge copays and deductibles. It's first dollar coverage for care that's delivered inside of Holista. So there's an incentive for that member to choose from what our options are, but they're always free to choose whatever they want. So they can go anywhere they want within the construct of the benefit plan. So we give them that option. They can take a look at what they have available to them. If they decide that they do want to do that, then we have the concierge and pathway support that kicks in. And then at the very end, it's one simplified bill. You only get one. I know anybody who's ever had a serious set of services, you're going to see pathology, radiology, anesthesiology, all the ologies, along with facility and a variety of other things. One bill from us. That's it. We roll the whole thing up. We take care of all the financial side of it. The important aspect for the employer is we can engage the members. We can help them understand what choices there are to be made. We can mitigate risk. We're aligning the incentives so that if that member makes the choice that they make, they can have a better care experience and often no out of pocket. We are accountable to the member, of course. They can fire us at any time, but we're also accountable to the employer. What we do is work with that employer on an ongoing basis to help them understand, we call it missed opportunities. So within a certain parameter, let's call it 30 miles, do we have episodes of care that were available that weren't used? And we want to try to understand why. And we work with the employer. Is it a communication issue? Is it an incentive issue? What is it that isn't driving us in the right direction for this? Because there's significant savings, often hundreds and hundreds of thousands of dollars that are being left on the table. I've already established these are high quality providers. There's an awesome patient experience, and most of the time it comes down to a communication issue. They just wasn't the member wasn't aware. I think Janet said that we're the best kept secret in Wisconsin, and often we feel that way. We're trying not to be, but often we end up feeling that way. I'm going to talk just for a second about the business model, and then I'm going to very close to opening it up to questions. There's no PMPM. There's no payment up front. There's no admin fee. There's no nothing. How do we work? So we negotiate. I'll just use an example. I'll negotiate a total hip with a provider at $28,500. We take all of those services that I've described and we put it in on top of that. And when you pay for that service, you pay $30,000. So you see the $30,000 number. You don't necessarily see what's underneath that, but you see the $30,000. And my number, my $30,000 number, has to be competitive with what's in the marketplace, right? Or why would you buy it? So my job is to get that sustainable number with those providers and still be able to provide you a cost savings, and typically it's in the 30 to 50% range on average, which means if we're talking about the 6 standard deviations, those numbers can be 60, 70, 80%, depending upon what the outliers would look like. So really, we're the value-based care easy button. One-stop shop, one plug-in technology platform, full service. Variety of care options available in terms of the episodes of care. One of the things that we just released and are building upon is chronic disease. Up until now, we've really been working with event-based, so acute care in the elective space. And we've been told by our employers that the other area that they're being assaulted on is in chronic disease. So we released allergy and asthma. We've released rheumatology. We are about to release diabetes, cardiology. We have some women's health work that we've been doing. And those are all coming to the market in 2026, actually Q2. Questions? Not everybody wants.
I got a question.
Yes.
So the policy that you purchase on each one of these episodes, when you say they can go to any provider after that, does they have to go to the provider within the Lista network or any provider they want? And
Anybody,
you all,
anywhere.
And you all help them navigate and find the place that they're comfortable with, right?
Yeah, we do. In fact, there's a whole team that kicks in. It's actually a Levitt team that kicks in when that gets triggered, and they work directly with that member to make sure that they're going where they're comfortable going. Depending upon the nature of the complication, the first visit could be ER, right? I mean, they're reacting to something that happened in a surgical situation, and so they may just show up. When that happens, the complication protection kicks in, and then that team gets in touch with the member, and they work with them from there on.
You ever see another routing, like so if somebody's going in for musculoskeletal and your physician looks at it and say, hey, I think surgery is the right way for you, maybe it's another treatment, do you all accommodate that as well? Or?
Yeah, it's a great question. Only 27% of orthopedic, anyhow, only 27% of orthopedic consults result in an actual event that takes place, a surgical event. In fact, one of the things that we measure is that 27%. We're seeing somebody at 40 where we're in there looking at records, trying to figure out why they're different, because it shouldn't be. The standard is 27%. One of the things that we worked on really hard early on was not wanting to say to a member, go away. So if someone is not a surgical candidate, we have a variety of conservative episodes that are out there. Some are MSK, some are allergy-based that do not require an event to take place, but are more of a focusing on keeping someone stable and helping them progress. So our MSKs are really trying to get stability back, keep that individual. Sometimes they may fail out of a orthopedic because of BMI or something along that line. Again, we don't want to say go away. We want to support them until they're a candidate, and whether they come back and say, gee, I don't need it now. That's the optimum outcome, right? Or they can come back and say, I've made these goals. I'm now a candidate, and that referral process can move forward.
You talked about the quality piece.
Mm-hmm.
What are you doing? How do you measure it? What is that? How do you determine who those quality providers are?
So our biggest definition of quality is reduction in variation. So that's the overarching thing that we're looking at and looking for. You then have the NCQA standards, which I said really is the ante to this game. I'm happy to share them. We have another dozen specific things that we measure. We're really looking at that practice, how often are they doing the surgery after consult? Frankly, some of it's, do you play nice in the sandbox with other people? I mean, they can be we've released a couple of clinicians who were super clinicians, but they didn't do a very good job communicating with their patients. They didn't do a very good job communicating with their facilities, ASCs and so on.
And how does that complications, what is the trigger for that? Does somebody says something? Like, what's the trigger for that being?
It's an insurance policy. You can be rest assured it's very well spelled out. But yeah, it's if somebody presents post-surgically and is diagnosed with a complication that falls within the bounds, and they're pretty wide, but fall within the bounds of those definitions, then it's triggered. But you're literally issued, if you were going through an episode, you'd be literally issued a policy. So you have it in your hands. Every episode has a policy that's issued.
Is there anything about compliance, the patient compliance? Is that part of the whole process? Like, you're advising them to do something and they're like, no, don't want to do that.
Typically, with our employer partners, and providers, we're given the ability to disenroll a member. So if that member says, I'm not going to do these things, or they consistently fail to do them, they'll be disenrolled, which just puts them back to their normal health plan and copays and deductibles. We don't see much of that, just because it's expensive for them, and we're not asking them to do the world. So it can happen. Other questions? Yes, sir.
You talk about seamless TPA integration. Any favorites? Any that you do well with, and any that you don't?
We work with all of the independent TPAs. We have a handful of direct relationships with larger employers that might use somebody that isn't necessarily an independent TPA. We do a lot of work with Prairie States. They've been a longtime supporter of ours. But we have business with, I want to say, every TPA in the state, and many that aren't but have business here. We basically, what we do is we send a funding request to that TPA for the bundle amount, and then we pay the downstream provider. So the integration is pretty simple with our TPA work. Sir?
I think I know the answer here, but how do you handle?
Wisconsin.
Right.
Oh.
Interestingly, this is the nature of the question. How do you handle organizations with large populations outside of Wisconsin and North Carolina?
That's a really good question. We do have partnerships with national organizations, one of which, and I'll do this by example, one of which is the Ortho Forum. The Ortho Forum has 1,300 practices across the country. We are able to access any of those under our agreement so that we can spin those up in markets where there are members that we don't cover here locally. There's a couple of other organizations that we work with that are similar to that. Orthopedics tends to be a pretty much of a bell cow. It's highly visible, often highly used. If we can establish a beachhead with that in a market, we can usually expand from there. It really does, and I don't want to overstate this, but it really does depend upon what the size of the presence in a market is. If you had 1,000 employees, it's pretty easy to build that out around that. If you've got 200, it's not quite as easy. But nonetheless, the partnerships that we have can serve any size. I've got, in fact, we just brought one up for 50 employees in Little Bourbon, Michigan, through Ortho Forum. So it works very well. Yes, ma'am.
In the example you gave, I think it was a $500 fee. How does that vary based on procedure, and is there a cap?
It varies by procedure. Obviously, the carpal tunnel isn't going to have nearly as much, because we don't do as much work, right? Whereas a maternity is going to have a little more because we're working with that member for an entire year. I don't know that we have a cap. I don't think we have anything higher than 9% built into it, and everything is mostly way below that. A good question. Anything else? Yes.
I had a question. You had a direct primary care.
Mm-hmm.
Your bullets.
So many of you have direct primary care partnerships, and some of them are commercial, some of them are homegrown. We work with all of them, both in a technological platform standpoint, so that MD or nurse practitioner can have instant access to, in their system, to what our network and choices are. So if they have an individual that presents who needs a hip, they can see what's in their general area for those, and they can start working with that member right at that point to talk about which choices of those would make sense to them. We meet with direct primary care regularly. because that's a really good channel partner for us, in part because of the education piece. They have, if we would love to see direct primary care serve a broader role in most of the groups that we work with. Their biggest challenge is their penetration in the groups, right? So most of these range from 10 to 40% that they may have seeing them. So there's still this 90 to 60% that's outside of their reach. But we're very focused on trying to help create that synergy. God, I hate that word. Allowing them to have as much information about us as they can. And then we're very much a resource for them as well.
Awesome.
Thank you. Appreciate your time.
Guys.
Good morning, everybody. Appreciate the, Janet, thank you so much. Thanks for the opportunity to get in front of everybody. My name is Ryan Moore. I'm with Twin Health. I'm in charge of our employer sales division. Live in St. Louis, so not very far away at all. This is Marissa. Marissa.
He's my boss.
Yes, Marissa is in charge of the Wisconsin area, and would love to, collaborate with you all further and kind of discuss it. If you don't remember anything I'm about to tell you, Twin Health is a cardiometabolic solution. We look at healing the root cause. We don't push pills, although we'll use them, but we don't push them, and we don't push a specific diet. We don't push pills, we don't push a specific diet. We feel it's very important to heal metabolism, which is easy to say, but hard to do, right? So one thing I always ask people is, you don't have to raise your hand, but we're in March, we're way past the New Year's resolution point. I know that a lot of people have tried different diets, it's hard to sustain them. And the reason is because a one-size-fits-all approach to losing weight and healing your metabolism doesn't work. It just doesn't work. But now the innovation is here for it to work, and it does work. So we're going to take you through that. We're going to take you through the innovation, but we're also going to take you through the clinical studies and the results that we have to prove it. Does that sound good? I think hopefully it'll be interesting to you all. So I like to start telling people about Twin Health by telling them about our founder, this handsome fellow here named Jahangir. So if you're my age, you'll know that you guys ever use a BlackBerry. Back in the day, you had a BlackBerry. So he's a technology guy, he's not a doctor. And so I think that's a very important distinction to start off with. The reason I brought up the BlackBerry, this little cell phone Wi-Fi thing in the BlackBerry, remember the thing it could toggle between, you're like, wow, it could do both. Like that was his company, that was his first company that he started and sold. His second company that he started and sold is called Jasper. So Jasper was the internet. Have you ever guys heard of the Internet of Internet things? Do people have heard of it? So think about putting sensors around really complicated objects like a Formula One race car, a Boeing jet engine, and studying it and analyzing it to understand how to make it more efficient. Does that make more sense? Does that make sense? That's called making it basically a digital twin of a very complicated object. That's where we get our name, Twin Health. So we've been around about 7 years, but in 2016, Jahangir sold his company to Cisco. He goes back to celebrate with his family, and his mom and his two of his sisters, they were just recently diagnosed with type 2 diabetes. So he's fascinated by this, like, that's terrible, tell me about it. They all had different answers. They were given different advice, they were given different things to eat this, don't eat that. And so what does a system engineer do? Like, he wants to solve the problem. He knows enough about medicine that you can actually you can reverse type 2 diabetes in many cases. Your body can heal, right, from that. So he's like, okay, the body can heal itself. I'm going to put sensors on these people, and I'm going to figure out their metabolism and how to heal them, right? He's a systems engineer. That's how he thought of it. That is exactly how Twin Health was born. Those were our first 3 patients 10 years ago. We've been in the market 7 years now. So what problem was he actually trying to solve? So I think he's trying to solve the problem that many of you guys have in your populations today. Their health is getting worse. Cardiometabolic isn't just type 2 diabetes. You look at the form of obesity, pre-diabetes, heart disease, liver disease, kidney disease, all of it's related. All of it's in a big basket, right? And it's going up and increasing, but about 50% of employees are affected. We know claims are rising in this group. And then we know the innovation hasn't been there yet. The technology hasn't arrived yet until now, because traditional care is kind of reactive. You go, yeah, I've done it, gain a few pounds, let's put you on cholesterol meds. You have pre-diabetes, let's maybe do an intervention, give you some general advice, maybe put you on a drug here or there, and see you in 6 months. And it just hasn't worked. And even though we've thrown money at primary care, and we love primary care, we love direct primary care, we are considered the metabolic console in their pocket. We'll get more into that. Other digital health solutions have come and said, I got the answer to this. We're going to solve this. We're going to give, okay, everyone's on keto. Everyone do keto. And it's like, okay, well, keto can work for a small portion of people for a not a very sustained amount of time. Does that make sense? So it'll work, but can it work for years and years and years and years? And the answer has been no, because if it did work, everyone would be on it. We wouldn't have all these issues, right? And then we've all heard of GLP-1s, right? That's a joke. We all have heard about GLP-1s. It's increasing costs, but are they working? Are they sustainable? Are they for everybody forever? Do they have side effects of nausea? The average person's on a GLP-1 about 6 months, 7 months. After they get off it, they gain weight and they're more sick than they started in many cases. Now, are they a good tool? We'll get into GLP-1s and hopefully have your attention with that. We use them as a tool, but they're not for everybody forever, and you have to look at the duration. Some people will use it as a tool. It's someone's A1C's out of control, and we got to get their weight down. We'll use it as a tool, but we also are on the road to deprescribing that eventually. Does that make sense? So that's how we view it. So what Twin is trying to solve is the root cause of dysfunctional metabolism. That's what we're trying to solve, is the root cause. And that is not an easy thing to solve. So this map here, it looks like, I don't know what that looks like a map of a nuclear reactor or something. That is, early on, we mapped one person's metabolism. This is what it looks like. This is all the fact. It's like a fingerprint. Everybody's in this room is different. And you have factors that make so this is what you're born with, right? Your own metabolism, but then your age, the meds you're on, what you eat. Are you a night shift worker? Are you a truck driver? Are you sedentary? Are you on a lot of stress? That changes your metabolism big time. And so what you have is you try to throw a one-size-fits-all solution at this, and there's no way it's going to work. It's going to work for some people. And I started off with that question, how many people started a diet and it failed? This is one of the reasons why. You hear, I mean, I was the person who I'm going to try Noom this week, and I'm going to try MyFitnessPal. I'm going to try this and that. It's just like, I wasn't getting to what would heal my own metabolism. So the way Twin was built was I think it's very refreshing for a digital health company. You hear a lot of them that are like kind of launched with a bunch of marketing, and they're kind of like flying the plane, building the plane as it's flying, I think is the first thing with that Jahangir did was saying, okay, we need to patent this and we need to figure this out in the AI and nail it. So we have a patent. We're the only folks that can create a digital twin of a human being to heal metabolism. That's kind of cool, right? Long patent on that. That's where we get our name, Twin Health. We are literally creating digital twins of people. It's fun. We'll get more into that. But it's more than the technology, and I really want to emphasize that. We have health coaches. We have physicians. We have sensor specialists. We have nutritionists. We have all these people that surround the member. If you just throw AI and an app at them, it'll work for maybe, we think 10 or 15%, 20% of that population. The rest, like we have people that get the app, they get the sensors, and I'll go over that. They're like, I'm good to go. About 60% of those people are like, need to talk to a caregiver every day. They need to interact with a health coach and nutritionist. They just need more. We have that. We'll go over that. The other thing we did before we fully launched in the market is we partnered with the Cleveland Clinic on a randomized control trial. The only one, so if you're comparing cardiometabolic solutions, the only one that has a RCT, a true RCT at the Cleveland Clinic, which is pretty good primary care, and Twin, Marissa's going to go over those results. That speaks for themselves. We're the only ones with RCT, and I don't want to see spoiler alert to your part, Marissa. It wasn't even close. like what we're able to do when you put Twin with really good primary care, and we talk to that primary care, we set up that link, which we do with lots of DPCs and lots of primary care docs. It's really can solve this. We really can solve this now. So the 3 legs of the stool, I'm going to go real quick, and then I'm going to give it to Marissa on the clinical results. This digital twin is with you all day. Well, that sounds weird, but it shouldn't. It's nudging you and guiding you every single day based on your metabolism. So are you stressed that day? What have you eaten that day? What meds are you on? What activity level you're at? And it's giving you best options all day long, not just in the past. So have you guys ever heard of a continuous glucose monitor? Like those are kind of the rage right now. You see all the commercials. That's cool data, but it's like telling you like, all right, now what do I do with that? My glucose went up, now what do I do? Like this is actually giving you action on what to do in the moment, but also what to do in the future to affect that glucose spike. Does that make sense? So that's what the digital twin is. Again, we're a solution. So we work with mostly self-funded employers. We also work with some fully insured as well. But our solution is type 2 diabetes, pre-diabetes, and healthy weight. Typically, BMI is set around 27 and up are the folks we work with. So how is it? Anyone curious how this thing works? So here's what I get a lot before I get into like the how it works part. 75% of our members are frontline blue collar workers. 75%. That's who our solution's for. So we had to make the tech really easy. So if you think about our population and who we serve truck drivers, we serve manufacturing facilities, we serve non-desk workers. We had to make it super easy so everyone can use this easily without having to fumble around with the technology because just stop it, I'm not going to use it anymore. Super easy. You get a kit, it has a CGM, you go get your labs done. It's a full set of labs, not just your standard labs, the 5 standards, but we go into insulin resistance, we go into inflammation. It's a big set of labs. Blood pressure monitor, a Garmin activity tracker comes with it, and an impedance scale. Once you get your setup, you get a call from a sensor specialist, and we are incentivized to get that person set up correctly because this whole kit is sent at our risk at Twin Health. Our entire program's at risk, and we'll go over more of that. So the person gets their CGM on, they get their blood pressure going, they'll go get their labs done, they get their scale, all that at 3,000 data points a day is put into the app. Now we're able to do some pretty cool stuff. We've now had a digital twin of that person, and now the AI inside the app can say, okay, here's how that meal and activity you did affected your body. That cause and effect is like fascinating to people. Like for the first time, they could say, okay, wow, I did that and watched my glucose drop. I did that and I could watch my weight drop. I did that and I feel better. Right? I ate it this time. I ate in this order and I feel better. And the AI is telling you to do that. The other thing, it's not just past and present, it's future. So consider this, like we'll all go to lunch after this, right? We'll think about taking a picture of the menu and the app telling you based on your metabolism, what's the best thing that you can eat to feel the best afterwards and have the least glucose spike and continue that and good for your metabolism. Right there in the restaurant. I did it last night. Take a picture, boom, eat that, great. I'm a rule follower, I'm gonna follow the program. I didn't used to be. So all day long, you're getting this guidance like, hey, like you didn't sleep well last night. Your Garmin tracker said you slept 5 hours, your glucose is spiking. And it's giving you guidance on what to do based on your metabolism in real time. Does that make sense to everybody? But it's not just I know it's an innovation day, and I want to stress this one point. It's very innovative, but we also just have regular old provider teams behind it with smaller panel sizes. And it's paired with clinical experts. Lots of them. So this is our typical member, Owen. We're going to come back to Owen in a second. But the first thing you get, like if you have an employer and you're interested in it, you'll call Twin and say, hey, I'm interested in this. And we'll look at it and say, okay, you qualify, great. That's what your enrollment advisor does. Your enrollment advisor would then say, I am now sending you to Quest or LabCorp, and I'm going to set your appointment for you to get your labs. At that same time, the kit is sent out, and then we have a sensor specialist call and make sure they get the sensors on. We don't have a problem with that. Then the primary care team is activated. We have a physician in charge. We have Dr. Bree in this case. She's actually mine. We have health coaches that are amazing. You can chat with your health coach real time. We have 24/7 coverage on that at any time within the app. We have registered nurses, and then you also have your AI digital twin, ask your twin inside the app where you can press a button and like, hey, my CGM fell off. What do I do? So instead of calling you or calling someone else, the digital twin will tell me exactly what to do. I'm shipping a new one and no one has to touch it. So again, people think of like, oh, this is really complicated. We're actually a provider team around an innovative solution. I hope that makes sense. So what does it look like in real life? So I have two folks here, Carla, who has prediabetes, and I have Owen, who's type 2. They have the same meal. Every other program on the planet is going to say, you have a lot of chicken right there. That's great. Like chicken. And you have rice. And most other programs will say, hey, get rid of the rice, just eat the chicken. Not very helpful, right? It can be for short term, but not long term. Like, I don't know about you, but like eating chicken for every meal or the rest of my life isn't great. I like carbs. I like things. We want to meet people where they are. So Carla, her goal, she just wants to lose weight, get her A1C under control. The app has noticed that the AI has noticed that with smaller meals. So have you ever been, I don't know, have you ever been trying to be like really good in the morning and then by the afternoon you're like ravenous? Like, okay, I do that every day. So the app has noticed that, like if I don't get Carla full, she's going to snack like crazy. That's her pattern, right? So it says, hey, the chicken's good. That's great. Rice is good. It's going to say, before you eat the meal, let's add carrots and spinach. Let's get some fiber in there to sustain fullness. Does that make sense? So then then the app is going to notice she's not snacking as much later in the day. We want to create fullness. And for Carla, her thing's fullness. Like she's like, if I can remain full and not sacrifice constantly, I won't go, off the deep end and quit the program. Owen, on the other hand, he has type 2 diabetes. We're trying to reverse it. We're trying to heal it. We're trying to get his A1C down. Our other goal with Owen is to reduce the amount of medications he's on. Like our people, and you'll see in the clinical study here in a second, our people, they get off insulin. They get off their GLP-1. They can get off their metformin. Like it's real and it can happen with the right program. So with Owen, we're like, hey, that's great. We want you to be full too, but you're type 2 diabetic right now. We haven't reversed it. We're still working with you. Swap that for cauliflower rice. Then we could actually predict before it happens based on their metabolism what their glucose spike's going to be. Within like 96% accuracy. It's pretty wild. Like I could take a picture of something like based on my metabolism, it could go up, 26 points. Marissa's may go up 12 based on her metabolism. Does that make sense? We do color code our food, red, orange, and green. So you've seen that probably scale before. Here's the crazy part, or interesting part. It's not crazy, interesting. What's red for me at first might be green for Marissa. What's orange for me could be red for you. It's not like it's the same food for the rest of your life. The other thing is what is orange for me when I started the program earlier this year becomes green when my metabolism heals. I love when things become green. I like it a lot because like literally you'll get a pop-up saying, hey, we noticed this is a food you ate that was orange in September. It's now green and you can have that. You can have it. Do you know how like liberating that is for people that are on diets and struggle with this? Like my metabolism will heal. I can handle this food and enjoy it with my loved ones and enjoy experiences. So the other thing I want to know is like, it's not just about what you eat. It is about activity as well. And walking's great. I love walking. I have a dog, walk the dog, it's great. But we also need to build muscle. So when you ingest glucose, there's a couple things places it can go. It can go into your fat cells, that's suboptimal. Or you can use it, or it could be stored in the muscle. If the muscle is already full though, it's gonna be stored in fat cells. So a lot of times what we do is say, hey, your glucose just spiked, go on a 15-minute walk. Or we tell them that before they eat the meal. But we just partnered with Peloton. Anybody who has Twin gets free Peloton. It's kind of cool. You press the button, it goes right to Peloton, it's free. And the cool thing about the Peloton is it meets you where you are. If you're stressed and if you had like a terrible night's sleep, it's going to have, it may suggest a low body weight exercise or yoga. But once you get advanced, it's going to start challenging you. You don't need a bike. You don't need a treadmill. It's just the hardcore pellets. You can get hardcore as you go or start off easy, but it's about building muscle. Like that's the key, one of the keys to this whole thing is building lean muscle. If you're on a GLP-1, your lean muscle mass goes down. Even though you try to fight it, it just really does. So a lot of times when we're titrating down a GLP-1, we're like emphasizing big time. And the impedance scale shows the patient's muscle mass every single day. So we know what their muscle mass is, and we're suggesting building muscle to them. And in fact, our physicians are trained, like if they don't have enough muscle mass, you can't titrate that GLP-1 down as fast because, you know, they won't do as well off that medication. Yep, Tim, thank you. So who's going to use this? People are like, this sounds cool. Who's going to use it? Is it hard? Again, we have 200 clients plus. We've been around for 7 years. People use it. And once they get engaged, it's like they're engaged. Like you've never seen engagement. So why? It's based on, have you had that based on your metabolism? It's pretty cool. Cause and effect is pretty awesome. Results are pretty awesome. You're getting your lab work done 4 times a year. Again, that's all on us. We'll go over the financial model, but pretty awesome. Like the cause and effect, and it works so well that after 1 year on the program, 86% of our members are still going into the app 7 days a week. 91% going in 5 days a week. I have kids, they're on TikTok. I just looked up their engagement score last night. So TikTok 2025 average was 62% of after the first year opening at 5. So we have a higher engagement than TikTok. And like, it sounds hard to believe, but it like once you're in the like you totally get how easy it is and why these folks stay engaged. And one of my people, and when you see some of our testimonials, you're like, well, why do they stay so engaged? I went over a little bit, but if you have type 2 diabetes or your A1C is 12, you don't feel well. And you give them a program where their A1C is dropping and they're getting off medications, they haven't felt this great in 20 years. That's the motivation that we're after. So from a self-insured employer standpoint, all of our fees are at risk. Marissa's about to go over those, and they line up with the savings very well that we'll show you. So we talked about the randomized control trial with Cleveland Clinic. I'm going to have Marissa review those. Yeah.
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 Okay, if there's anything that you also just heard from Ryan is the excitement in his voice. So I am exactly the same way in terms of how I feel about what we're doing at Twin. I have my CGM on, and I invite anybody who is interested after, you know, the meeting today to come back and look at the demo. We've probably both got the app up, and I continuously look at it. It's fascinating. So on that note, I'll just start with where Ryan left off in terms of our results from our Cleveland Clinic randomized trial. And as he mentioned, we are the only solution that has published a randomized clinical trial. And this one was with the Cleveland Clinic. And again, the results pretty much speak for themselves that you can see on this slide. These are kind of the top measurements. I'll talk a little bit more about some detail around them, but you can see here, we basically had 2 types of care. We had a group of type 2 diabetes patients that received obviously gold standard world-class care with Cleveland Clinic. And then we also had a group of type 2 diabetics that received care with Cleveland Clinic, that same primary care, but also had the Twin Health intervention. You can see here in terms of the A1C difference, the usual care at the Cleveland Clinic, we were able to bring down that A1C by about 2.4%. But what the one group that was with the Cleveland Clinic and the Twin Health intervention or solution, we were able to bring down that A1C below 6.5 for 71% of the population. You can see the average weight loss is almost double as well in terms of the solution and the primary care versus the usual care. And what's astounding to me, back to GLPs, which we'll talk about in just a second, is that the usual care at the Cleveland Clinic increased the usage and prescriptions of GLPs by 21%. The portion of the population in this study that was with Twin Health, we reduced the GLPs by 85%. Significant. What's more important to also understand is what else took place in this study. And Ryan started to mention this early in the conversation. All of our systems in the body are connected, right? So we're not just talking about healing one thing, the blood glucose or diabetes. You can see here from this study and what Twin Health is doing in terms of healing a dysfunctional metabolism is also healing your cardiovascular system, liver disease, the MAFLD, that is what used to be known as non-alcoholic liver disease. Significant change versus the usual care group. So I think this is really important to just come back to where Ryan started in the presentation, where we're healing the root cause of a dysfunctional metabolism in all of the systems of the body. So really quickly, I know we want to make sure we have time for questions, but in terms of GLPs, this is a really interesting study that we did too. This first graph that you see up on the slide is very typical, right? It really is showing the blue line is somebody who has been on, or a group of people in this instance of this study that has been taking GLPs. They obviously are losing significant amount of weight when they're starting that GLP. You can see in the pink or the red line with Twin, we also help them achieve about a 3% more weight loss. What happens, again, as Ryan mentioned, when people go off of these GLPs after 6 months, 12 months, whatever the case might be, we know, and it's been proven in the market, unfortunately, that these people are gaining back a lot of weight. When you start a GLP, you're losing fat, muscle, and bone. When you gain it back, unfortunately, it's purely just fat. You're not gaining that muscle mass. You're not gaining that bone back. So it's really important to be followed by a physician, which is, again, an important piece of what we do at Twin with that care team. But what's significant on this slide is that you see that weight gain when somebody went off a GLP without Twin, but with the Twin solution and that care team and the small changes in daily habits that we're making with our members are continuing to lose weight. They're not gaining it back. And then again, as Ryan mentioned, with the Peloton application, our providers and our app, our digital twin, are recommending weightlifting exercises so that we're not just looking at fat gain, we're continuing to build lean muscle mass. So I think this is really significant in terms of GLPs to understand. And again, we are not against GLPs in any respect. We figure they're a tool in our toolbox of things to use as we work with our members. So just a quick note here, just a snapshot of some of the plans we work with, some of the employers we work with. And really quickly, so we have 1 minute for questions. Ryan mentioned this as well. We do a unique billing situation. We only bill for outcomes, clinical outcomes. So we're not PEPM based. We don't have implementation fees or admin fees. We really just bill when members are getting healthier. You can see here by A1C reduction, BMI reduction, and then high cost med elimination. Those are the things that we actually bill for, which obviously on the other end of the spectrum helps employers bring down their medical and pharmacy spend. So I'll stop there and just leave this up, but Ryan and I are happy to take any questions in our last minute or so here. No questions?
Right here.
Oh,
I think one of the hardest things I've heard from people who are
Yeah.
tracking their food or use the CGM is that it eventually becomes stressful. They get tired of taking pictures of their food. They think they're doing well, and then their CGM spikes, and eventually they get too stressed out and have to stop.
Yeah.
How are you guys solving for that?
Yeah, I think that's really important. I think in a couple ways. I think the first thing is the health coach that's assigned is super important for motivation early on. We get results pretty quickly with our program. It doesn't take that much time. We're seeing significant results for that patient within 90 days. So a lot of the motivation is coming from the health coach and the doctor. So if we see they haven't logged in a couple of days, the AI will ping the provider and we'll calling them. Remember, we're at risk for them getting better. So we are very incentivized to keep them engaged. Once they actually start feeling better and losing weight and seeing the effect, we're off the races. So it's typically that first couple weeks. We do make it very easy with the CGM and the sensors, but with the AI tool, you don't sit there and type it in. There's voice. You can take a picture, or you can just. Have you guys used like the Gemini or ChatGPT where you can talk to it? You can do the same thing with our tool inside. Be like, hey, I'm at this gas station. I'm a Quick Trip. Like, what's good for me to eat here? And it'll tell you. So it's that kind of, and then it'll log it for you after you eat it. So I think it's ease of use, but also the health coaches and doctors that's kind of our magic that keeps people engaged early.
Awesome. Thanks, guys.
Yeah, thank you.
All right. Next up, we have Fajoya. I think this will be really interesting. I know there's a little presentation demo swap here with the IT folks, so we'll let you work through that. But one of the things I know I experienced as a benefits leader and heard from employers as a consultant was how fragmented their benefits ecosystem is and how difficult it is to have engagement. And I think that is the problem that Fajoya is trying to solve with their product. So thanks, you guys.
Thank you so much for having us today, Janet, and the BHCG group and Baird for hosting us. My name is Tim Sherman. I'm the sales director with Fajoya, and I'm here with Moore. She is the VP of payments, so we're really excited to talk to you. What we do at Fajoya is we really focus on the employee experience, right? We want to get them engaged. You all do a lot of work to pull a lot of levers, put in a lot of direct networking, do a lot of things to save on the plan and the spend, and give them a lot of solutions that will make their life easier. And our goal, and at Fajoya, we're backed by AI-powered benefits experience, and our focus really is, to unlock new levels of the employee engagement experience. And we deliver data-driven personalization through our AI outreach with recommendation in real time. And again, it's a seamless experience that brings the whole experience together. We like to say we're kind of like the virtual front door to the entire health and benefits experience. So as we talk today, and as more demos the solution, just think about some of these things. The biggest things that we hear about often is, do your employees even know the benefits they have? Do they even remember what they enrolled in 4 months ago during open enrollment? More importantly, where are they going for their answers? What we hear a lot from our HR people and CFOs we talk to is, what's scarier is what you don't know. You don't know what questions they're asking. You don't know where they're looking for guidance or steerage. How confident are you as a team or an organization in the answers that they're finding? And how often does the confusion turn into HR outreach, miscare, or even frustration? So it reduces utilization and engagement with your employee population. Kind of the engagement gap we're solving for employers, we're are three areas, right? Benefits underutilization. Again, you put a lot of levers, a lot of solutions in to not only drive down the cost of healthcare, but make it easier for them to access their healthcare and benefits. Employer decision-making. Really a lot of confusion. They don't know where to go. There's a lot of great things that they have access to, but most employees don't know about it. They don't know how to access it, nor do they want to spend the time accessing it. And then finally, HR administrative burden. You know, we hear a lot of HR teams spend an excessive and an inordinate amount of time trying to answer questions or guiding employees where to go to even simply just get their medical ID card. And oftentimes you get that call, hey, I'm at the doctor's, where's my medical ID card? I need it now, right? So the whole point is really just not only simplifying the benefits access, but empowering employees to make decisions simple on the spot when they need to, and reducing the HR workload for better benefits engagement and utilization experience. So HR is, oh, that's not loading. But so the solution for Joya was really built on a modular benefits engagement platform. We are mobile led. We do have a website, but the goal is to be in the hands of the employee at all times. When we talk about a modular benefits engagement platform, for you all, what that means is you don't have to replace everything you've already put in. It's not a rebuild. Our goal is to build around, support what you have, and enhance, right? So as you grow, as you bring in new things and other point solutions, you can bring in Joya, because our AI assistant is going to really help enhance that experience. And our goal is just to make it easier for employees to be able to access their coverage, ask questions, and get direct answers, and then get actionable items. And the way we really do that is we also focus on benefits communication and engagement. With the benefits communication, we want to make sure that not only are we communicating on the benefits that are available to them when we're answering questions, but we're providing that next step. We're providing that steerage and that navigation to the programs that you're already incorporated with the direct network pricing, with all of the cost-saving initiatives you've rolled out. We also believe communication is key. We've talked to a lot of HR leaders, and they either have a really good communication setup, but they don't know how to roll it out, or they have not built a great communication setup, and they're just kind of relying on the employees to engage with the app. But what we find is by delivering a solid communication strategy, whether it be pinpointing certain employees, whether they're 50 and over, to make sure they're getting their colonoscopies, which are covered, or females 40 and over to make sure they're getting their cancer screenings. It's really about reaching out and being able to singularize the communication or the engagement experience. The one thing that we have found that has been really big is our policy to payment. Integrating Joya's AI digests contracts. It looks at policies with payment infrastructure, and it creates a smart administration of the direct provider cash payments. It does automatic eligibility, which has been determined based on the employer and provider direct contracting that's already been set up. And we're able to do that member coverage eligibility on the spot. We're able to do automatic payment substantiation based on the contract's criteria, invoice, and additional defined requirements. So you define it. We work with your partners who are already handling that, but we provide the automatic substantiation for the required payment. And we do a generation of a payment card. So we provide that card for them to provide that payment directly to the provider for those bundled services or those cost savings. Moore's going to show you more of that. Again, that's really what she's specialized and built out for us. For employers, it's key because it's the preferred pricing, lower healthcare costs, and because we're able to drive and engage with them, we're able to highlight that they have those services available. For the employees, it's a consumer-like experience. It's very easy to navigate. It's very easy to utilize. And then there's immediate billing. There's immediate payment, so there's no billing. There's no collections. There's no confusion. It's super easy for the employees. And we, again, just want to reiterate, we built this technology to support employees, right? We believe engagement is the biggest gap, often with getting all of these things to flow the way you want to. And we have infused AI at every level, from back-end automation of taking all of the contracts, all of the policies, enabling rapid configuration, all the way to the front end, which is where our AI assistant connects directly with the employee when they're asking questions or they're needing that steerage. And it's market leading flexibility because we're able to, like I said, build around. The whole thing is to be modular. We're able to be very customizable, and we're fluid throughout the year. So as you need to make adjustments or bring new things in, we can do that. And we're not here to nickel and dime as we build that out for you. And then really the way we built this is we want to make sure that it is easy for you all to implement. We don't do implementation load on you all. We handle all of that by getting all the documentation. We do focused pilot launches. We want to make sure that we can start small if that's what you're looking to do. Really focus on these targeted pilot programs to validate solution impact with employees with minimal risk, and then build from there. Modular implementation, I already talked about. It reduces the load and the burden on you all as an HR team on everything that you need to do, or as consultants. I know there's some consultants in this room. We take all that bear and brunt on up front. And then, like I talked about, that rapid configuration and iteration, right? We can build as we go too. We can adjust, we can pivot. If there's things you want to add or you want to enhance or moderate, we can do that very, very simple. And then once you see what you want, or we have what you want in place, what you want it built, we can scale fast, right? We can grow very, very fast. And with that, we're going to get into the demo, because I think once you see how this works, it's more powerful.
Let's see. All right. Can you see it? Perfect. So what you're looking at right now is the FJoya employee app. So we're looking at Emily's app, and I'll take you through some of it. As Tim mentioned, we have two main parts to our app. The first one is the one front door to all your benefits, to really understand and explore and know what you have. And the second one is the AI assistant, where you can go and ask all your questions. We'll deep dive into each and every one of them. And while we're doing it, again, keep in mind, this is very modular. So each employer can choose whatever parts that is relevant for their workforce or for their needs. And also you will see throughout the app that it's branded FJoya, but it definitely and easily can be white labeled and be branded for the for the employer's brand. All right, so let's start. The first part is the one-stop shop for all your benefits. I can see here in the home page that first and foremost I have my plans. So everything that I enrolled to, I have all my plans. I can go into one of them, see the different information, what's my contribution, what's my member ID, look at the card. And my favorite option here is to send the card to the provider really easily. So you see, I press this little button, and then I can just enter an email and send the card to the provider. So that's very useful. Going back to the homepage, the next thing I have is targeted communication, those little story-like squares. So instead of mass emails that never works because you get bombarded with information, and we always talk about how do you know what you have. So in here we have targeted, personalized, relevant communication based on what we know about Emily from what we got from the employer, but also what Emily chose to share with us. So at the beginning, when you download the app and you do the initial onboarding, we have an optional questionnaire. You can share your health situation, health journey, whatever goals you have, and we will use that. This is, of course, optional, but I think it's a good time to stop and say that at FJoya, we take privacy and security really seriously. We're SOC 2 Type 2, we're HIPAA compliant, we're GDPR compliant, so employees can feel very comfortable sharing with us. And in this case, Emily shared that she's dealing with diabetes, so again, we can press it, see some targeted communication about managing diabetes. different services that she's entitled to, and easy access to those. Yeah, what happened here? Oh, yeah, sorry. It was, sorry. Another example is something that are important for the HR team. So let's say it's Breast Cancer Awareness Month, and because Emily is a female over 40, we want her to see this campaign that her employer set up for her. So we can see some information about breast cancer awareness, and we can be very, very proactive about our employees' health journey and help her schedule her free mammogram and get her going there. So that's also good. The next part is, just exploring benefits, and based on what we know about Emily and her behavior and everything that we have in our systems, we can recommend the best benefits for her. I mean, what's relevant for her, things that she's entitled to, things that she's already enrolled to, and really help her make the most out of her benefit stack. And the next part is even a to-do list with things that she might want to achieve in order to be on top of her health. And again, engaging with the employee and making sure that they're on top of their benefits and they're making the most of it. This is the first part, and now I want to move to the second part. So as Tim mentioned at the beginning, two major things that we're worried about. First of all, that the employees know what they have? But the second, where do they go with their question, and how do we make sure that they get accurate answers? And this is where our AI assistant goes into play. You can see I'll press the purple button with the magnifying glass, and this is our AI assistant. We feed our AI assistant with all the relevant documents. So health plans, SPDs, employee benefits, we can integrate with HRIS. So everything that's relevant, our AI tech scans everything and really learns it. It goes into our closed system. So again, it's not out there, it's not in the internet, and we can give relevant, accurate, non-generic, no hallucinations, so the right answers for every question regarding, by the way, everything HR, everything benefits, and everything about your health plan. So I will just go to the chat I had with it just now because I wanted to be quicker. And let's go over the question. We can add more afterwards. The first example I have here is that how am I covered for dermatology? So, a straightforward question, and I see that, the AI assistant tells me, how am I covered? How much will it cost in network? It tells me that, out of network, it will be a different cost. So again, steering me to make the best decisions for me. It shows me that I also have an option for a virtual care that might cost less. And then I have quick actions that I can take, like find a provider or look at my member card, etc. But it can be even more ambiguous. So maybe I have this question, I'm feeling depressed. Maybe I don't even know where to start or what is it that I'm asking here. And I like this example because, first of all, the word depressed does not appear in the health plan, in the document. So our AI actually needs to be intelligent, understand what you're saying and what can help you. And also, this is something that I might not feel, or Emily might not feel comfortable sharing with her HR team. So sometimes it's even easier to ask those kind of questions, this AI, which is not, someone that you know. So again, the AI assistant look at all of the different benefits in our stack and can give Emily the best answer for her. So first of all, it will tell her that she is entitled for Lyra Health. So she has 10 free mental health sessions. And then, if she needs more, what is covered through her PPO, other resources that she might find relevant. And I also like the fact that it starts with this empathy and feeling sorry for her and try to work on it together. Again, we have those quick actions that you can take. So it's very responsive and you can continue the discussion. Another example I wanted to show is maybe managing someone else's, my dependent care health. If Emily is lucky like me, I had this experience a few months ago with my son, and he broke his leg. And I have to say, my initial, instinct was to rush him to the ER. But when I asked the AI assistant about it, they say, okay, you can take him to the ER. It will cost $150, but you also can take them to urgent care, and that will cost $50. So you have all your options in front of you, and it also tells you how much other services that you might get cost. So if you have an X-ray, or if you need some kind of equipment or ambulance. So I have all my information, so I'm not going there, without knowing what will happen. Another thing that I really like about it, that it reminds you that you also have accident insurance, and you might be, able to get payout and to get some funds to, to cover all those bills. So again, very, very nice and very, it helped me to know what's the next step for me. We talked about the fact that the answers are very specific and not generic. So I tried to ask, what is my 401k contribution? And again, the answer was right for me and not for any other employee in my team. So my contribution is 1,600, and it shows me, how is it billed, and if I want to change it, what do I need to do? So again, goes with you and helps you. I can ask how many vacation days do I have left, or whatever, you ask HR, so everything is there. The final thing I want to show you before we move to questions is what Tim was mentioning, the policy to payment. So we know that there are, in many cases, and more increasingly so, employers will want to carve out some of the medical services and directly contract with a provider, with a health provider. And it was important for us to enable this journey as well, and to make sure that this is super smooth, and that we take care of it end to end, including payment. So not only just knowing where to go, but enabling cash pay model. So I have an example here. Let's say I write, I need a knee repair. So the AI knows that for knee repair, my employer is contracted with a specific provider. So immediately it gives me the information that I have a special flat price bundle with Montefiore, which is a health center in the New York area. This is how much it will cost. This is what will be part of this bundle. And maybe Emily wants to learn a bit more about this Montefiore because the employer chose it for her. So I press tell me more about Montefiore, and then I get some information, regional ranking, national recognition. So I get more comfortable with this decision. And then when I want to move forward, I can upload my referral. I press this button, upload the referral, and then, as Tim mentioned, FIJOIA looks at the referral, the AI scans it, does the substantiation, and then says, great, you are authorized to do it. You can see exactly where to go. And then I can also, sorry, I have this thing bothering me. I can press view my corporate card, and then right on the spot, we are issuing a virtual card that you can use, loaded with exactly this amount, or more accurately, limited to this amount, for you to use only at this provider. So you're able to now just take this card and pay at the provider site. That's it. No billing, no need to finance and then get reimbursed. So everything is super smooth and you're ready to go. That's it, I think. If you have any questions, something that you want to see, please go ahead.
Can that payment also be issued by someone other than a member, like a TPA that's looking for an additional payment option? Does it have to be done by the member?
We can integrate with TPAs for sure. It's not a problem for us. I mean, if you have a process in place, we can be embedded in this process. So definitely.
Do you have a desktop version too? or is
Yeah,
it just-
yeah, we do. We know that a lot of employees find it easier to do it on desktop, and also we found out that they work with our solutions a lot of time during working hours. So definitely we have a desktop solution. Just love the app so much, so I like showing it.
So when you mention that it's modular, if somebody's, like you said before, they've spent a lot of time getting registrations on their website, you can actually come in if they just want the AI assistant.
Yeah, again, the AI assistant is a very strong tool, and we can give it as the solution. I mean, altogether, if you want just the AI assistant, if you want it to be, part of your other systems, that's not a problem. Also in desktop, it can be added. So,
Yeah, and to touch on that, we're not trying to replace anything. We're trying to enhance, right? We know it is a lot of work to replace things. It's also, in my experience, because I've done this for 6 years in the engagement space, a relatively low investment for you as an employer to add this on. Again, it's building an enhancement, and it's adding to your benefit flow, your benefit operation. The whole goal is just to increase engagement, utilization, and then support. And with the policy to payment, to me, is one of the biggest things we do, because again, we're supporting that direct contracting. We're making it easier for employees and their spouses and their dependents to get care and save money doing it, right? Because like I said, you pulled all those levers. So our goal is to just make it easy and accessible, and we can integrate with whoever you're working with as far as TPA partner, direct contracting partners, whatever that may look like. Again, it's to be super easy. Now, let's say you say, hey, we're going to pay for half of this procedure, or we might pay for all of it. The way we'll set it up is it'll say, hey, of the $2,600, your employer has said they'll pay for $1,300, and then not only can you upload your own card, again, we are SOC 2 certified, it's all secured, but you can use the employee's card to pay for the $1,300, and then you can use your own card to pay for the other $1,300. Again, this works, as you all know, because the sooner the provider gets paid, the lower they're willing to go, and generally the better care and the better post follow-up care that they get. So a lot of employees don't know they have access to these programs unless they're constantly being hounded by it. And again, like I said, what's scarier is you don't know what you don't know, because employees are afraid to ask those questions. And so this really bridges the gap. It's not a high lift, it's not a high cost, and we build as you go, right? We support this as you go. Our goal is really to bring in what you need to bring in. It's not to bring in everything, but the biggest thing we've been seeing is the AI assistant, and it's been the policy to payment, which is truly unique. Because with our AI assistant, it's that front end and that back end. It's a dual integration, which a lot of our players in this space are really just front end.
Thinking about these kinds of solutions and total rewards, kind of outside of that benefit space, one of the challenges I think that has been out there is garbage in, garbage out, right? So how and do you support employers in, kind of looking at their HR and benefits policies and documentation, whether that's in, a Workday solution or a SharePoint solution, what have you, to actually get that to a point where the AI can make the best use of it and really direct employees and relieve that administrative burden?
Yes. So the answer is yes, we can integrate with all that. Our AI is taking all that information in, and then it is doing that steerage and navigation directly for the employee based on what they're interacting with or what we see. And we're getting a lot of information as well, so we're able to direct that employee ahead of time. So if we know that they've gone to the orthopedist, we know we're able to direct them to the centers of excellence for imaging or direct contract for lower cost for imaging, lab work, and then work with your direct contracts. And like we have a client that works with Langton, right? So we steer them and navigate them directly to Langton providers. We show the upfront pricing and we help them.
And do you, let's take an example of kind of smart AI. Are you thinking about, maybe I'm an employee and I've looked for an OBGYN or I'm, starting that journey to having a baby. Do you then actually, does the AI smart enough to look at the HR kind of ecosystem and say, hey, you have maternity leave or paternity leave, and
Yeah.
kind of funnel you in there so you're getting your paperwork in on time, your questions are answered, and those types of situations.
Exactly, and that's a great question. So that's one of the things that we can do. And so part of the answer to the question on the, my son broke his leg, right? So not only do we highlight the options, but we highlight the accident, and then we're gonna do follow-up, and we're gonna say, hey, how's your son doing? Did you take care of it? Did you file a claim with your accident insurance, right? Do you need help filing that claim? We will guide them and direct them where they can go download the claim form, and then they can go do that, right? So they can get the money for that.
And also to your question, we see all the HR policies, everything you choose to share with us, and we know how to direct employees so they can have a quick action saying, okay, so fill in those forms and send it to HR. So those quick actions buttons are really useful for those kind of things. And we can ask about how many days am I entitled to have for my maternity leave, and then this will be the next stage. And also something about your first question, you as an employer, you don't need to now look at all your files and policies. Some of them are in Workday, some of them are in the portal. You don't need to work for us and start, making sense out of them and putting them in a specific order. No, just load everything. We will take care of it. This is part of what our AI assistant does. So the system is able to do it.
Yeah, and to answer, and I know we're almost done here, but just to answer the full scope of that question you asked. So if someone tells us that they're pregnant and they're looking for all of the coverage that they have, not only will we highlight their maternity leave or paternity leave, not only will we highlight the solutions or the care, the direct bundled care that they have access to, but we're also going to check in with them to make sure that we know when they're having the baby. And once they have the baby, we're reminding them, fill out the dependent form, add them to your plan, and do those kinds of things. Because again, employees forget, they're not thinking about those things in the moment. And the whole key of the AI is not only to answer questions, but it's really steering, navigating the whole ecosystem of your benefits. Thank you so much.
Thank you.
Next up is Moby. So for those of you maybe who aren't familiar with Moby, Moby focuses on your multi-chronics and those that, honestly are pretty high cost, but also very overwhelmed with care because they're dealing with multiple aspects and sometimes competing solutions. So with that, I'm going to welcome the Moby team. So.
There we are. Hello, everyone. My name is Jake with Moby. Easy name to remember. Not Jake from State Farm, Jake with Moby. I did wear khakis today, so we got you covered there. We saved the best for last, which means there's one more after me. I'm excited to share more about Moby with you today. We're not the giant white whale or the 90s artists. We take an innovative approach to chronic condition management. And we're your neighbors. I'm from Minnesota, where we're headquartered, like a good neighbor. 2 State Farm references. I should start charging those guys. Like I said, we take an innovative approach to chronic condition management. We've been at it for the last dozen years. We started out serving large commercial, fully insured health plans, cut our teeth on that line of business, ran our randomized controlled trials, got our validations from actuarial firms like Milliman, Havarti Risk, and we've taken that same great model and we've deployed it to the self-funded market. Our threshold is 2,000 adult members. That's inclusive of employees and adult dependents. So think of that as you have groups in mind. We still do our health plan line of business. On the commercial side, we do some Medicare work as well, and then the self-funded business. And really the reason we exist, the problem we solve, has to do with individuals who are struggling with multiple chronic conditions. Recent data from the CDC says that now over 50% of US adults have multiple chronic conditions. And we all sit here and nod our heads and yeah, the math adds up on that, but that's insane. Over 50% of US adults have multiple chronic conditions. Something isn't working. What's even more surprising is we see that same trend within young adults. Over the last decade, a 25% increase in young adults struggling with multiple chronic conditions. And you all know the challenges that result from this: rising healthcare costs, overwhelmed employees, they're difficult to engage. There's a lot going on. Ultimately, where this shows up most is not just in the specific conditions. If you were to take those 4 or 5 conditions out and plop another 4 or 5 in there, you'd have a lot of the same participant challenges: financial strain, stress, sleep issues, weight management issues. The list goes on. And ultimately, it shows up within the utilization patterns for these multi-chronic individuals. These folks are in and out of the healthcare system: doctor's office biweekly, pharmacy weekly, longer hospital stays, frequent ER visits, lots of providers, lots of prescriptions. They're stuck on this hamster wheel within the system, and they're not getting the resolution that they seek. Furthermore, this problem is only perpetuated because as employers and consultant teams, we're forced to focus on high-cost, high-risk individuals. And that's all fine and good. We need to do that. But in doing so, we're missing this mid-tier claimant, this rising risk individual who eventually becomes this high-cost, high-risk participant without intervention. It's been touched on in a few of the presentations already, but the healthcare system isn't set up to help these individuals. It's a volume game, right? How many people can we get through that provider's door? Over 80% of doctor's appointments now end in a new prescription. It's not helping the problem. It's putting a Band-Aid on it. And I could probably ask any one of you to open your email inbox, and you've probably got several marketing emails from all the singular focus point solutions that exist in the marketplace today. It's a busy, crowded space. Over 1,200 different point solutions exist in the marketplace. No wonder it's really hard to solve this problem for a multi-chronic individual. So what do we do about it? Well, that's where Moby comes into play. We identify this segment of the population differently. We look at those utilization patterns. We're not identifying the population we focus on based on specific conditions, based on certain risk levels or cost levels. We're looking specifically at those utilization patterns within the healthcare system through claims data. I'll touch more on that in a little bit. Once we identify the population, we invest heavily to engage those individuals as a human, not as a diagnosis. And when you pair that message of value front and center for a human and what's valuable to them, it's really easy to connect them and help them take the next step appropriately. How do we take that next step? Well, we connect them with our health guides and licensed clinical pharmacists. That guide, that pharmacist, co-create a health improvement plan, considering that whole healthcare picture, all aspects of their chronic conditions, and really optimizing lifestyle behavior change and medication optimization, that blend that allows us to effectively move those individuals forward. Thus creating better health outcomes, reducing utilization within the healthcare system, and creating savings. 100% fees at risk model that I'll walk you through. On average, we save 7.5% savings year 1 against this segment. I'll dive into more of each of these aspects as we go. I mentioned it starts with population identification. We take in claims data to do this. Moby partners with your carriers. We take in 3 to 4 years worth of historical claims data. We handle any fees associated with that. And through that data, we're looking at medical claims, RX claims, eligibility files, and we're identifying roughly 20% of any given employer's population. Again, inclusive of employees and adult dependents. Some of the characteristics I talked about already. These folks, again, they're in and out of the healthcare system, not yet your high cost claimant. On average, they're costing anywhere from $18,000, $20,000, $22,000 a year, but trending higher year over year. 9, 10 different providers, 15 to 16 different prescribed medications. Over 50% of this population has 4 or more chronic conditions. Over 80% has 2 or more. So it's really that focus on that multi-chronic individual. Although Moby focuses on this segment of the population, anyone on the plan can opt into Moby that's an adult. We're not targeting our outreach or performance efforts against that segment because we know these are the individuals that need help. But they're certainly welcome to participate within Moby. Now, engagement. Everyone asks, well, how do you engage these individuals? It's $1 million question, right? And there's no one thing that drives engagement. It's a combination of things deployed in a very specific way. Starts with the data. When we're getting those claims data feeds, that long-term historical data and those ongoing feeds, it helps us identify who needs the help and when they need it most. that population is already primed to participate. They're just stuck within the healthcare system. They're on that hamster wheel. They're seeking resolution. They're just not finding it. So the data is a big piece of what we do. We launch a 16-week launch campaign full of engagement strategies, all the usual suspects here, direct mail, emails, outbound phone calls. We fully fund incentives that we send out to the Moby selected population, something like a $50 Amazon gift card once they complete that first phone call with a guide or pharmacist. We have additional incentives sprinkled in throughout the program, again, all fully funded by Moby. We have various campaigns that we launch throughout the performance year as we're working with the population. We partner with clients on internal signage at various factory sites for manufacturers and things of that nature. And then one of the biggest things that helps drive engagement for us is we have a whole department called an engagement department. It's full of actual humans, not chatbots, actual humans. And turns out 2026, humans still do like humans. And these engagement specialists, they're heavily trained on tactics of motivational interviewing and fundamentals of influence. When they connect with one of these participants, 70% of the time that results in scheduling a call with a guide or a pharmacist. Again, placing that message of value. You're not going to a diabetic and saying, hey, we need to lower your weight and get your A1C under control. No, what's important to you as an individual? You may have diabetes, but maybe it's 3, 4, 5 on the list. You're a single mom, you work 2 jobs, you can't sleep at night. You just want to go for a walk around the block, but even that's hard. Let's start there. Let's gain that trust so that you can give us the authority to then lead you and help you move forward. Big piece of our engagement strategy. We drive 30% year one, robustly defined as actively working within our program, ongoing conversations with their guide and pharmacists, work within our digital app through that as well. And ultimately, once that individual is engaged, that's really where the rubber meets the road, connecting with our guides and pharmacists. Our guides and pharmacists, full-time Moby employees, our guides come from a wide variety of clinical backgrounds, think OT, PT, nurses, chiropractors, et cetera. Pharmacists, PharmDs, many of them hold additional board certifications in various pharmacy specialties. And it's really through the work of that guide and that pharmacist co-creating a health improvement plan specific to the individual that allows our participants to move forward effectively. We use self-perception of health surveys. We work with that individual ongoing. There's no end stage or graduation to our program. On average, participants spend about 6 to 8 months actively working with their guide telephonically, about a half-hour call every week. But we're always there. That cadence and frequency can change over time. We typically contract with clients for 3 years. And if a new diagnosis pops up, a change in the medication history, we're seeing that through the claims data. So they can pick up those conversations again as they're working with that guide and pharmacist. The value here is that one-to-one relationship. It really is the gift of time that we spend with these individuals. It's the same guide, the same pharmacist. We offer Spanish and English speaking guides and pharmacists as well as engagement specialists. And the power is really in that one-to-one valuable trusted relationship that's ongoing to help these individuals in terms of everything they have going on within their healthcare picture. I want to touch on the work of our pharmacists a little bit more. The guide work is really important, but a lot of times the first domino to fall for someone to make a lifestyle behavior change is through medication optimization. Our pharmacists don't prescribe. That's intentional and on purpose. These folks have enough going on within their healthcare picture. We don't need to add another prescriber, but we need to optimize what that picture looks like. Our pharmacists are providing what's called comprehensive medication management. This is layers above and beyond traditional MTM offerings. We're not looking at only prescribed medications, but also over-the-counters, supplements, herbals, topical medications. And we're making those recommendations back to not only the participant, but to the various providers for that participant as well. Very high adoption rate, 95% plus. There's a lot of follow-up and follow-through here. This isn't a one-and-done consult or call. Again, it's the gift of time and that ongoing relationship that we're able to uncover these things. A lot of the recommendations are made on things like cost, access, safety, side effects, dosage. If someone's taking a prescribed medication and maybe they're taking a baby aspirin every day and there's a weird interaction there. Well, uncovering those things, again, allows that first domino to fall so that participant can move forward effectively. A lot of time spent with these individuals. I want to bring it to life a little bit here with a participant example. You see Angela here. She's a Moby participant. On the right-hand side of the screen, you can see the fragmented approach she was experiencing prior to working with Moby. She has those 4 different conditions across the top that she's struggling with. She had a 1-year delay in a type 2 diabetes diagnosis, a GLP-1 that sent her to the ER, lots of medication in the picture, lots of providers in the picture. You can imagine how frustrating it was for Angela, bouncing around like a ping pong ball within the healthcare system, but not getting better. She actually failed out of a digital-only weight loss solution that was sponsored by her employer. After 10 weeks, she failed out of it. She couldn't keep the weight off. That was her main goal. She wanted to lose weight. She couldn't keep the weight off. When she came to Mobi, lo and behold, guess what one of the side effects was of one of the medications she was taking? Weight gain. Of course she couldn't keep the weight off. Things were working against her and they weren't put together in a way that allowed her to move forward. So when we started working with Angela, we were able to optimize that medication picture. Again, our goal isn't to take away medications. It's really meant to optimize that picture so that that participant can best move forward on the best foot. We lowered some of the clinical things when it comes to A1C, kidney function improved, her headaches decreased, and guess what? She started losing weight. And when you think about Angela, she's one of thousands of Mobi participants, but when someone like Angela starts showing up to work as the best version of themselves, amazing things happen, not only at work, but also in life. And I think that's the important thing to note here with that profoundly human approach. If you think about where we fit within the benefits ecosystem, certainly questions around this, right? Well, where does this program fit, or how does it work with all my other programs? Upon implementation with any client, we take an inventory of all the solutions and things that that employer client offers. And where Mobi fits, if you think about us sitting outside the healthcare system, we have our arms wrapped around this multi-chronic individual, helping them from a whole person perspective. Where we interact with the healthcare system is through our recommendations made back to the providers for that participant. We're not a navigator, but we never want to be the end of the road for someone. So we'll complement navigators well, the Quantums, accolades of the world. We're not here to replace the PCP. We're here to complement that relationship. We'll refer folks into virtual care and things of that nature. And then if the employer offers specialty solutions, EAP mental health resources, cancer care solutions, fertility support, we want to be able to help that participant. And as part of that inventory, we're reporting and tracking all of those referrals that we make as well. Last slide, the savings. This one's always important, right? Everyone wants to know, well, what are the savings? How do you measure that? One of the founding principles of our founders at Mobi was not to add cost to the healthcare system. We want to leave people better than we found them and create savings as a result of the improved health outcomes that we drive. So we have a model here, 100% fees at risk across the categories of actual claims cost savings, participant engagement, and improvement in lifestyle metrics. 100% fees at risk across this model. Question you might ask is, well, how do you measure claims cost savings? It's an actuarial exercise. So we'll look at plan design, trend, truncation rules, outlier caps. I'm sounding like an actuary up here. This is pretty cool. I'm not an actuary. We'll look at all of that. We'll sit down with you, the benefits team, the consultant team, your actuaries, and we'll align on that benchmark for this Mobi selected population. So that roughly 20% we've identified, what do we anticipate them costing in the next 12 months? Once we've collaborated and aligned on that, we'll agree on that benchmark, run our program for 12 months, snap the chalk line at 12 months, allow for a few months of claims run out, and measure our performance back against that benchmark. Did we actually create the savings or did we not? A few different ways to bill through this model. We can charge your classic admin PM against the Mobi selected population and then true up at the end of the year. Or we can offer claims-based billing as well. So you can see those savings from the same bucket that you pay from. So if you remember anything about Mobi, aside from my beautiful face, it's that we identify the population differently based on utilization patterns. We get a multi-chronic individual who's a mid-tier claimant, rising risk. We invest heavily to engage that individual through a profoundly human approach, and we work with them from a whole person perspective, blending lifestyle behavior change, medication optimization to drive savings, improve health outcomes, and leave people better than we found them. Thank you, and I'd love any questions.
I'm curious about how do you get the buy-in by the PCPs to work with your pharmacists? How does that work?
Yeah, so when we start working with an employer client, we want to take in an inventory, everything that they offer, right? We sit outside the healthcare system, so we're not stepping on the toes of the PCP. That employee may go to their PCP and say, hey, I'm working with this great program called Mobi. They're working on some lifestyle stuff. The pharmacist is the one who's going to interact with those PCPs. So there's a lot of good follow-up and follow-through that happens there. Again, not only prescribed medications, but things outside of that, right? And so a lot of times the feedback we get from the PCPs is, oh my gosh, I had no idea that Jake was also taking that supplement with this. Had I known, I wouldn't have recommended that dose. Yeah, let's go ahead and change it. And when we're following up, you know, provider offices, 2026, they still like fax. So we're faxing, we're emailing, we're following up with phone calls and having the conversation. And if you think about the multi-chronic individual, 9, 10 different providers, there's a lot that can fall through the gaps there. So the feedback is often warmly received, and it's more of, oh my gosh, I had no idea, or had I known, I would have done this instead, or thank you for letting me know. Yeah, let's adjust it. Yep, I see where you're coming from. That makes sense. Those types of
So
conversations.
the concept is introduced by the patient to their PCP.
We are making the recommendations back. So we'll actually reach out to the PCP.
Okay.
Yep.
Okay. Thank you.
Yeah.
I could go into a long diatribe about this too, but I think PCPs really need this help because they take one class in medical school on pharmacology. I just did a big research project for a national organization, and this is an area where we all think it's being captured, but it's not. It's not being captured by the PBM. It's not being captured at Walmart where they get all their prescriptions. It's not being captured at some of the hospitals. So, you know, when you have a pharmacist looking at this, and I think Moby also uses some AI behind the scenes too, to aggregate all those prescriptions together to point out where these things happen, because sometimes people can be going, like you said, multiple doctors. The other thing too, I've talked to several physicians, you know, where they get most of their information about new pharmacies or pharmaceuticals in the market from their pharmaceutical rep.
Yeah.
So they don't have any unbiased kind of approach. So they're prescribing things out of the best interest, but they don't know if that medication has a serious interaction with others.
Well, I think it comes back to the gift of time spent with an individual to intimately know, what are you taking? Why are you taking it? Why was this prescribed? Why are you taking this supplement? I mean, I was talking with my grandma last week and she's like, I started taking vitamin D. Why? Oh, I heard it was good. Did you check with your doctor? Nope. It might not be good, right? And so having the time to chat with someone who knows the ins and outs of your specific set of circumstances is really helpful. And our PCPs, they would love to spend this time with the individual, that the healthcare system isn't set up to help that multi-chronic person achieve success, because with your PCP, you might get 7, 8, 9 minutes if you're lucky. And then, okay, we'll see you next year. Here's this prescription. Good luck. Any other questions?
I have one. So just kind of going back to your financial model, I just want to make sure I understand. Are you actually doing the claims cost savings on the identified population? And so is it a true cohort kind of situation? We're looking at their costs and then saying, okay, right, we're actually saving money on this population?
Yep, that's right. We're looking specifically at the Moby identified population, and it's all tied back to claims line level detail. So we're getting the ongoing claims feeds from the PBMs, the carriers, and then we're also doing that actuarial exercise on the front end to align and agree upon that benchmark. And then, of course, adjusting if there's any material changes, you know, throughout the year, or changes in plan design, or carrier migration, or maybe that employer client implemented an RX savings program. All those things come up.
All right. Last is certainly not least. I just want to, we're going to wrap up this morning with WellDoc. You may know WellDoc. You have a big history, and they've been around for a while, but I think they are an organization who has continuously evolved and really perfected kind of what they're trying to do with their digital models. So with that, Kathy. Yep.
Great. Hi, everybody. I'm Kathy Brunner from WellDoc. Really great to be here. I'm located here in Wisconsin. WellDoc is located in Columbia, Maryland. Actually, I should go back by the mic here. I'm used to wandering around. So I was saying, I'm Kathy Brunner from WellDoc. I'm based here in Wisconsin. WellDoc is based in Columbia, Maryland. And as Janet said, you may or may not have heard of us, but I wanted to start with a little bit about who we are, quick recap, and then go into what we do. So we a couple things just on the bottom left there as you're looking. So what I find interesting about what we do, we're very diversified, and you may have used us. So we are the power behind Lilly and CVS Health, MD Live, all the various apps out there, or not all of them, but the ones I mentioned related to weight management and diabetes. So we started out as a diabetes company back in 2005. And a few of our differentiators, I have the 11 there on the top left of the screen. We have 11 FDA clearances for our diabetes product. And we have a 12th one that we filed related to predictive CGM. So predicting the future, somebody's predicting what somebody's blood glucose will be into the future. And we're really all about that, trying to be proactive versus reactive. So, and why, maybe from an employer viewpoint, are the 11 FDA clearances important? They're important because they show our clinical rigor. Basically, our messaging, our diabetes, all of our messaging, and specifically with diabetes, it's gone through the rigor of the FDA for the clearances. So someone can be assured that they're getting clinically rigorous information. And then we have, and I could share with any of you, 100 publications, now 100 plus, which would be proving our outcomes, over the course of the about 20 years we've been in business. And I wanted to talk then about the 400 plus that's indicated up there. So we have a little different approach. And what the 400 plus is we connect with over 400 plus devices that usually a member will already have. So it's a little different approach than sending a package or whatever. A lot of times people are using a blood pressure monitor, a CGM, a weight scale. They have a whole bunch of these. In fact, we hear from people sometimes that they have 5 of these sitting here, 3 of these sitting, these devices. So we find it's more cost effective, and individuals prefer oftentimes to use something they know how to work, they've worked with it. So we're gonna connect normally to the devices that they already have. And then on the bottom right, I just put something. We've won a lot of awards for our AI and our innovation. So what do we do? Oh, this one came across a little bit maybe hard to read. Sorry about that. But so our vision is really to be the cardiometabolic health leader. And if I'm sitting here as you, I was kind of listening to everybody's presentations. I'm like, there's been a lot today on cardiometabolic health. There's been a lot on AI. And so, how do we differentiate ourselves? So as WellDoc, and really for employers and what I'm talking about today, we're going to be a digital-only solution. Now, we can pair with clinical teams. And as you see those small screenshots up in the top right, we have, our main product is our mobile app, and that members, patients will use. We also have in the middle there a clinical portal. So although we're digital only, we're able to pair with clinical teams. And that might be an on-site clinic, that might be a specific other team of individuals. So we do have a care portal that some of our clients use. And the benefit to that is really that the clinicians can see all of the data. They can see everything that the member has in terms of data and manage them as a patient that way with all their specific data. And then of course on the far right, we have a little snapshot of our population health stats. Of course, we provide very robust reporting in terms of the employee population. But what do we do then? So we are a cardiometabolic platform. It's one platform for the conditions, and I'm not sure if you can see them, the cardiometabolic conditions around pre-D, type 1, type 2. We work with weight management. We work with heart failure, high blood pressure. We work with some of the specific kidney conditions. And then we build in a mental health and well-being support module into it. So a client can use the whole platform, or they can use pieces of the platform if they're, if they're supporting their members in a specific way. So parts can be turned on, parts can be turned off. But really, I would say we're we're a little different than the other approaches that I've heard this morning. We're digital only, and we're going to really come from the standpoint of empowering the person to achieve the goals that they're looking to achieve. So they tell us that there's a quick survey that they do at the beginning. They tell us what their goals are, what their medications are, and specifically like around weight management, we support members whether or not they're using GLP-1s. So there's different approaches. Once they tell us they're on a GLP-1, or if they're not, their journey is a little bit different. And I wanted to make a comment related to the 400 plus that I mentioned earlier. So when possible, we're going to integrate with, these are examples of partners that would be integrated into the WellDoc app. And these partners, or this integration allows people to get their data seamlessly. They don't have to do anything. So my Apple Watch, I can, it's going to track my sleep, my weight, my activity, things like that. That's going to go right into the WellDoc app. I can sign into my labs. I can, CGM. You may have noticed we partner with Abbott and Dexcom on CGM. So whenever possible, we're going to have members add the permission so that WellDoc can be just seamless. And then in other cases, they're going to report. They're going to report some of their symptoms. They're going to report their food. And we have all the easy capabilities. Of course, they can scan. Our AI scans their plate so we can tell what they've eaten. They don't really have to enter anything in unless they want to make a correction. And another example, we have geolocators, so they can send grocery lists. They, Instacart. They can do a number of things seamlessly, or we make it very easy for them to input. And really then, what we're doing is, of course, we know that people use apps, MyFitnessPal, they use different apps for different things. Really our goal too is to have one place to have this data so that it can be integrated together. So people, instead of being fragmented, people can see all of this together. And of course, this helps in managing their conditions. And so this is, these are some screen samples of what the coaching looks like. And I wanted to make the point here that really the coaching is in the moment. So again, it's AI-based. So one of the advantages to AI-based coaching is it's going to pick up on the far left, and it's an acute example of low blood sugar. And the person is in the moment coached. The AI picked up, this person could be wearing a CGM or a blood glucose meter. It's going to pick up on a low blood glucose level. And in the moment, it's going to coach them on what to do and what to eat, potentially, eat some fast acting carbs, that type of thing. The second example is the ongoing guidance. And this particular individual is on a weight loss medication. And we're going to coach them through and ask them a number of questions. What symptoms are you feeling? And coach them through. And I know people mentioned earlier, the right thing, the right exercise, the right proteins to eat, what to do. So their journey will be different if they're on a weight loss medication versus if they're not. And then we have another example of pattern recognition, because we all know AI is really good at pattern recognition. So in this case, it's another blood glucose example of a pattern. AI has picked up on the fact that this person's blood glucose is, before breakfast, going typically in the last week, say at 145, but after breakfast, it's spiking to 310. So in the moment, they're going to be notified of this pattern and what they can do about it. And then throughout WellDoc, we have a lot of education. And again, our approach is more self-empowering individuals to meet their goals. And so we're going to provide a lot of education throughout the, just in little snippets usually, so they can work on improving what they want to work on. So I have a couple of other examples, and I know personalization, everybody talked about that, and that is really key to the experience with WellDoc as well, in that they're not going to see any real generic information. They're going to be seeing, whether it's any of these things, their nutrition targets, recipes that they want, goals, activities, everything is going to be personalized based on, their conditions, their goals, what we know about their medications. And one example is meal planning. So we use AI. Person can say, I want, meals for the next week. I want it to be this. I'm a vegetarian. I'm this. I prefer this. And we do not support or promote any specific meal program like a keto diet or others. We're going to provide support for people no matter what, they're going to tell us what their what their meal preferences are. And they can use AI then to make their meal planning very easy and intuitive. And then again, as I mentioned, they can send a grocery list to Metro Market or wherever they are to make it very easy. We have community, so people can get support from community. They can make comments, they can get information. And we have an AI assistant as well. We call him Simon. Simon can really, the thing Simon can't do is provide very specific medical advice. Doesn't do that. But if somebody says, what's a GLP-1 or how do I pair with this particular device, whatever their questions are in more how to use the app, in more general medical information, they can use Simon to get the answer. And we're going to keep improving that because we know AI can go a long way with helping people and maybe taking some of the more routine clinical questions and guiding people that way. And as I mentioned, we support the weight management journey, whether or not they're on a GLP-1. We usually start with an 8-week journey, very specific content for each of the 8 weeks. And then I wanted to just mention one of the things we're doing that is a little different is we know that many in the medical community and many of us think, a lot of times we're using BMI as a measurement, and we know that really doesn't tell us about the person's body composition. So one of the things we're doing is body mapping. We have body mapping technology. So with my camera on my phone, I can do a body mapping in the privacy of my own home, all confidential, and we lay out the privacy policies. But I can do body mapping to let me know, what's my percentage of fat, what's my percentage of muscle, and it breaks down my body composition so that I can see specifically for me what it is and what I can work on. And we report that, of course. There's a report that goes with that. And then I wanted to highlight, these are some of the last screenshots here, but wanted to highlight, again, we're really trying to self-empower individuals with their own data. So one of the things we do right within the app is we provide a weekly report. So I can see, just looking and flipping through this area of the app, I can see what my weight trends has been, what my nutrition, my activity, all the things that we're tracking. I get this weekly report. So again, we're trying to empower people so they can take action, so they can easily see their own data. And then we also provide a trend report. And we also take the approach of we support the PCP. So an individual can share these trends with their PCP. So we have a way they can e-fax, they can print if they want, they can get it over to their PCP so that when they walk in the office, they have specific data. And we all know how it is. You go to the doctor sometimes, it's like, how is everything? Good, good. Everybody's good. No one, has that very specific. Now, maybe it's not good, but I don't know really how to express it to my doctor, or I really don't have the information specifically on what's happening. So this allows the individual to go over their trends with their doctor. And we think that's a real advantage because it's very specific on anything that they're tracking. And then engagement and retention. And I'm just going to hit these quickly, but we have a full program too, in that it has three real phases to it. So when an employer says they want to work with us, we're going to start the awareness campaign, then we're going to go on to an engagement, and then we enrollment. And then we do ongoing engagement campaigns, because I know one of the things that has happened is a lot of times people get engaged for a short time, then they kind of forget about it or they fall off. So we're going to continue the campaigns to make people aware of this benefit. Maybe it wasn't the right timing when I saw it at annual enrollment. So later, if someone outreaches, it might be the right timing for me. So I might want to engage at that point. So we do a full and lots really rich campaign and communication suite. And then these are the engagement and retention results that we're seeing. And we think they're really high because, again, I think it points back to the personalization and the fact that if I know this is my activity, my weight, my numbers, all personal to me, I'm more apt to look at it daily, engage. So we're seeing about 30 engagements a month for people after they download WellDoc. So of course, we're seeing about 30% of those eligible in the front end, and then once they get going and they download it, it's about 30 engagements a month. And of those, about 20% are daily users. And we find, the 8 times refers to like somebody can set a goal, they can be engaged, and all of that's going to show on their home screen what they're engaged in, what their progress is. We know that they're going to engage more if they're setting goals. And then my last slide here is on our outcomes. These are divided into 3 sections here: diabetes, weight outcomes, and then cardiometabolic outcomes. And you can see, I won't read these, but you can see the different A1C, tracking A1C improvement in the diabetes outcomes, time and range. Of course, weight is mostly based on weight loss. And then we're measuring blood pressure reduction. And at the bottom, you see the numbers of the annual savings that we're seeing for the various programs. And we also do a performance guarantee. We can do 100% fees at risk. We're typically doing that with splitting those into categories like A1C reduction, weight reduction, engagement, other types of metrics that we're measuring for the employees. We'll normally pick about 5 of those mutually with the client and then guarantee fees based on those. And, I want to say also, one of the things an employer can do is, offer this at a savings, because of course we're AI only, digital based. So that's going to create a savings because we don't have the clinical team expenses, and we're still seeing significant results. So normally we'll be, maybe a 6th, a 7th, the cost of a solution with clinical. So with that, I'm not sure what my timing is here. I think I've got a few minutes if anybody has any questions.
A question, not really a question, but maybe just more of a statement. I heard you mention kidney as well, right? That's something that I hear you said you're all looking into helping members with understanding their kidney function as well.
Yeah, sorry, Aaron, and what was that?
Kidney function?
Oh, yes, kidney functions. Yeah, chronic kidney disease, MASH, and so forth.
Years ago, when I worked in national accounts, every time I got a claims report from Northwestern Mutual, the groups I worked with, I never saw anything around kidney function. DaVita stock is going crazy high, and now 13% of DaVita patients are actually in the employer space. So this cardiovascular incidence. So do some research around, kidney health, because usually they don't get referred to their eGFRs below 30, and that's already stage 4 kidney disease. So this is going to start impacting the employer population. So I encourage all solutions, as you're talking about cardiometabolic. In 2023, the American Heart Association coined the phrase CKM. I've been in the industry 35 years. When they said that to me, I was like, I've never heard of this acronym. They are all tied together. So that's going to be an important thing for innovators, for TPAs, for payers, across the board, to make sure that we're helping people identify this condition, because usually when they hit there, the next treatment is what? Dialysis, which costs an employer about $200,000 a year. Not a big number yet, but something that's emerging, and that everyone in this room has the opportunity to learn more about and offset.
Yeah, thanks, Aaron. Yeah, definitely CKD, MASH, diabetes in pregnancy, so some of those specialty conditions, we can help them, especially manage the symptoms that they're seeing and try to help them make lifestyle improvements so that they can help that condition. Any other questions? Janet?
So, digital only and digital first, it's hard, right, to keep kind of longer term engagement. And I think in your slide, you showed kind of continuous engagement for 14 months.
Yeah.
how are you re-engaging individuals, you know, kind of after that point, or re-engaging them, if you will? Because I imagine that, right, this journey isn't over, and I think everyone probably realizes that, right? Like, this is a lifestyle effort that is long-term, so.
Yeah, so I would say two ways. You know, we're looking at our reporting to see if they drop off. And I don't think I mentioned, we do have a like a customer care center where they will reach out. So it's not necessarily medical advice, but reach out to help people, you know, hey, I noticed that you haven't used WellDoc in X amount of time, and just help them re-engage, find out why. Maybe they have an issue with the app, something's not working. So we do it through a customer care team. And then we also do it with those ongoing communications. So we're going to keep the communications going. I know a lot of times it's up through implementation or up through go live. We're going to keep the communications going as the ongoing, as long as the program is available. We're going to keep the communications going.
Any other questions?
You could also co-brand too a little bit, right?
Yeah. Yeah, I didn't, so we, with those partners that we work with, we're very familiar with white labeling, co-branding, you know, single sign-on, things like that. So we have a lot of technology that we can use to integrate WellDoc into what they already have. Okay, thank you, everybody.